Welcome to Hospice Excellence. I'm your host, Nina Hart. I'm an RN and certified hospice and palliative care nurse, and ACHC and CHAP consultant, and I'm the owner and lead consultant at Heart Healthcare Solutions, and we provide accreditation and compliance support for post-acute care providers. On today's episode of Hospice Excellence, we're going to talk about ways that you can better prepare your hospice for upcoming changes to the HQRP, or Hospice Quality Reporting Program. As it goes a little more in depth, it's going to be a little less focused on just admission and discharge measures. So we're going to look at more of a broad picture throughout the stay and how their symptoms were managed. And it's also going to have a heavier focus on hospitalizations, unplanned hospitalizations and return to hospitals, and revocations due to symptom management, because that reflects that patients might not be getting managed in the home. And so we want to look at things like changing the level of care. That might be utilizing appropriate GIP or continuous care, or that might look like utilizing your staff better to engage patients more from admission to discharge and everywhere in between. So more touch points between your agencies, families, and patients throughout their stay. So that could be utilizing check-in calls. I like agencies that do check-in calls at 24, 72 hours, and you might even need to add some more throughout the length of their stay. That might be something you have your case managers do, or you could build that into your visits. One thing I really love is our partner, FireNote EMR. It's very intuitive, and their informed intelligence model is really great for capturing this information in a way that's going to reflect the patient's current status in a detailed, accurate way. So your clinician can go in, they can address these areas, and it's really going to capture that for the patient and reflect that quality of care. And it's going to provide a better picture throughout their stay consistently of where that patient's symptom management is at and what's really occurring in their plan of care. So I love that about that. And they also have a really great quality function where you can go in and QA those notes where there are symptom changes or condition changes, and really collaborate as an IDT or IDG, whatever you need to do to make sure that that discussion with your team happens and that plan of care update happens to reflect that they really are having their symptoms managed and their plan of care is individualized. Whatever EMR you use, you should make sure you lean really heavily into that collaboration piece to reflect that whole team involvement in managing those symptoms and that quality, those quality outcomes. That collaboration is going to be a big thing, and especially when it comes to changes in condition, follow up on after hours changes in condition, timely follow up for changes in condition. You want to show that your agency and your hospice medical director or that attending physician collaborated on that change in condition as the patient declined, as their symptoms and their plan of care changed. So that's going to be a big focus, especially for surveyors, to say, was the IDT engaged and updated on the changing condition? What happened that caused the patient to decide to revoke? Did they not get timely follow-up on their symptoms? And when you're looking at those quality measures where their symptoms worsening and were not addressed in the home, and that was the root cause of that hospitalization. So these are all going to be components we can focus on for upcoming changes to the HQRP. And I think really leaning into education with our case managers, if you have admission nurses, and the clinical leadership team, as we integrate and spread these out through the stay, is going to be really helpful in capturing that true collaboration between your team. And upping that documentation and really reflecting that collaboration and education is going to be the way we're going to do that. So I hope that was helpful. I would love to hear your thoughts on this, what you're looking at for your team. I'm looking forward to connecting with you all, and I'd love to hear your thoughts and feedback, so let us know. As always, please subscribe, stay with us for more updates and more content coming out soon.